All right, let's dive right in. Welcome to this explainer. Today, we're going to explore the surprising, hidden complexities and the completely unintended consequences of the medicines we take every single day. Look, we place a tremendous amount of trust in modern medicine, right? We trust it to heal us, to knock out our infections, and to manage our chronic conditions. But there's actually this silent parallel story running alongside our healthcare systems. It's a story of unexpected reactions, hidden costs, and this fascinating biological balancing act that happens every single time we swallow a pill or get an injection. To truly wrap your head around the sheer scale of what we're talking about, let me ask you a question. What do you think is the fourth leading cause of death in the United States? You're probably thinking, okay, heart disease, cancer, maybe oxidants? But the reality is actually a massive medical mystery that hides in plain sight right inside our clinics and hospitals. The answer to that question is adverse drug reactions, or ADRs. And to bring this a bit closer to home, let's look at this absolutely shocking number from the UK's National Health Service. 5,700. That is the number of fatal adverse drug reactions that occur in UK hospitals every single year. To put that into perspective, roughly 0.15% of all hospital patients suffer a fatal reaction to the very treatments that were meant to heal them in the first place. So the takeaway here is that this isn't just some rare freak occurrence. We are looking at a massive, hidden epidemic affecting morbidity, mortality, and hospital resources. Adverse drug reactions are linked to 6.5% of all adult hospital admissions, and once inside the hospital, 6.7% of patients suffer serious reactions. This creates just an enormous strain on healthcare systems. We're talking an estimated £466 million annually for the NHS alone. And it doesn't even stop at the hospital doors. Up to 40% of patients out in the community experience these reactions too.
Section 1. Decoding medical terminology. Drugs versus medicines.
First things first, before we can really understand why adverse reactions happen, we need to completely rebuild our vocabulary. In everyday conversation, people throw around the words drug and medicine like they're the exact same thing, but scientifically and clinically, totally different. Let's start with a drug. In its absolute purest medical sense, a drug is just a chemical. It is the raw active compound used to prevent, investigate, or treat a disease, or to intentionally alter a physiological function. When medical professionals are talking about a drug, they're strictly picturing that raw active ingredient and how it interacts with the receptors in your body.
Contrast that with a medicine. Now, a medicine is the drug or a mix of drugs combined with pharmacologically inert substances. These inert substances are absolutely crucial because they form the delivery vehicle. They are what turn that raw, unpalatable chemical powder into a nice coated pill, an easy-to-swallow liquid, or a topical cream that actually makes the drug useful and safe for human therapy.
This distinction really matters. The drug is the raw chemical. The medicine is the therapeutic package. You see, you might be perfectly fine with the chemical itself, but have a nasty reaction to an inert dye or a binding agent used in the medicine's packaging. Or, on the flip side, the specific delivery method of the medicine might completely dictate exactly how intensely that raw drug hits your system. Section 2. The good, the bad, the hairy, side effects.
Okay, so now that we know exactly what we're putting into our bodies, let's talk about what happens next. When you take a medicine, it obviously does what it's supposed to do. That's your therapeutic effect. But a side effect is strictly defined as literally any effect other than the therapeutic one. And here's where it gets pretty wild. Side effects aren't always bad. They can be harmful, sure, but they can also be completely neutral or surprisingly beneficial. Take this clinical case study. Here we've got a 52-year-old guy who was prescribed a medication called finasteride. Originally, this was administered to treat benign prostatic hypertrophy, so an enlarged prostate. That was its main intended therapeutic job.
But while he's taking the medication for his prostate, doctors and patients started noticing this highly unexpected yet highly beneficial side effect. He was experiencing significant hair growth on his scalp. This side effect was actually such a massive success that it fundamentally changed the drug's entire trajectory, flipping a prostate treatment into a global blockbuster medication for male pattern baldness. And this next one brilliantly illustrates another example from our source data, latanoprost. This was originally used to treat glaucoma by lowering pressure in the eye, but boom, it triggered this highly visible side effect, the rapid growth of eyelashes and vellus hair. What started as just a totally unintended chemical consequence quickly became this highly sought-after cosmetic benefit.
Section 3. The villain. Adverse drug reactions. All right, we've seen the good and the hairy,
But now we've got to pivot to the darker side of things. While side effects is this big, broad umbrella term that includes things like hair growth or harmless quirks, there is a specific, narrower category that is actually responsible for those massive hospitalizations and tragic mortality rates we hit on earlier. We call these adverse drug reactions, or ADRs. The strict medical definition of an ADR is any undesirable effect of a drug beyond its therapeutic effects. Notice the keyword here, undesirable. Unlike a broad side effect, an ADR is strictly unwanted, inherently negative, and potentially incredibly harmful to the patient.
Let's see how this builds in a real-world scenario. This is case 1, a 34-year-old woman whose patient journey takes a really sudden turn. On day 1, she's admitted to the hospital with a severe case of community-acquired pneumonia. The doctors do exactly what they're supposed to do. They treat her with IV benzylpenicillin and doxycycline. Fast forward to day 4, her chest is clearly improving. The pneumonia is retreating, but she begins to complain of this severe, absolutely unrelenting itch.
Her respiratory infection was cured, but the penicillin triggered a massive, inflamed rash covering her entire back. This really grounds that sterile medical terminology in stark human reality, doesn't it? To understand why this happens, we have to look at immune system hypersensitivity, which basically comes in 4 main types. Type 1 is immediate, like your classic, scary anaphylaxis. Type 2 involves cytotoxic antibodies. Type 3 is driven by immune complexes. And type 4, which is exactly what we're seeing here, is a delayed, cell-mediated reaction. Basically, the chemical intervention sparked a brand new, incredibly painful medical crisis.
Section 4. The Science of Predictability.
So, if drugs can cause this much collateral damage, how do we predict who's actually going to suffer? Well, it mostly comes down to patient factors, things like age, genetics, and underlying health conditions that ultimately determine a person's susceptibility. Take case 3, a 65-year-old man who just started on Ramipril to manage his high blood pressure. 2 weeks after starting the medicine, he gets some routine blood work done, and the results are alarming. His baseline creatinine level, which is a key marker of kidney function, was a perfectly healthy 90. Within just 14 days, it spiked to 245. That indicates a sudden, severe drop in kidney function. He's experiencing acute renal impairment directly caused by the medicine that was meant to help his heart. To understand why this happened, we've got to pull back the medical curtain and look at how doctors actually classify these ADRs. They categorize them by their relationship to the drug's mechanism. Primary effects are usually pretty predictable because they're a direct extension of how the drug is designed to work. Secondary effects are only sometimes predictable, and unrelated effects, those are usually not predictable at all.
Let's use our patient on Ramipril to see this in action. Ramipril is an ACE inhibitor. The severe renal impairment he suffered is actually a primary, predictable effect. Why? Because ACE inhibitors fundamentally alter blood pressure by dilating blood vessels, including the efferent arteriole in the kidney. In some susceptible patients, this completely predictable mechanism drops their filtration rate way too low, and boom, creatinine spikes. On the flip side, getting a dry, annoying cough is a secondary effect of that exact same drug. It happens because the drug also coincidentally prevents the breakdown of a specific protein in the lungs. One is a direct mechanical consequence, the other is just a biochemical byproduct.
And that brings us to the ultimate takeaway. Our bodies are just incredibly complex chemical ecosystems, and every single chemical we introduce shifts the balance in ways that can be brilliantly therapeutic, unexpectedly hairy, or dangerously adverse. Knowing that even the very best life-saving medicines have hidden effects, are you monitoring your own health closely enough when you start a new prescription? And crucially, if you do experience an adverse reaction, you have to report it. Medical systems completely rely on patients and doctors submitting these reports to national databases like the FDA's MedWatch or the UK's Yellow Card scheme, so they can track drug safety and protect everybody else. Understanding and reporting adverse drug reactions doesn't just make for fascinating science, it makes us safer, more vigilant, and far more informed patients. Thank you so much for joining me for this explainer.